We had 4 nice talks, but the bad thing is that we spoiled most of the time that we were giving. So I guess we have only time left for 2 or 3 questions from the audience, either for the implementation talks or for the theory on infection or the controversial between antibiotic and operative treatment.
There. I can see the question there.
Thank you so much for the presentations. I welcome it. I'm from Croatia, so my colleagues are here. My most important point I would like to ask the whole panel in general is with osteomyelitis. It was a very interesting talk of Professor Martinez as far as the long-term outcome. We saw the short-term outcome, that's antibiotic treatment versus surgery. My interest is, what is the long-term outcome? Do you have any data to prove that the 5-year healing rate and less recurrence in the group of patients you treated with antibiotics alone? In other words, the non-surgical treatment of the infected diabetic foot ulcer osteomyelitis.
It was hard to understand, but the question was on long term.
I'll simplify the question. The question is, what is the long-term result?
Your
5-year result.
Yeah. I asked the board here, has anyone long-term data on the outcome of conservative versus surgical treatment of osteomyelitis? Because we've only seen the short-term outcomes. Any information on the long-term outcomes?
No. At the moment, no. Only we had the information during the period of the study. The period of the follow-up was 12 weeks, only 12 weeks. We are working now to long outcomes for both group during more time, recording other variables, for example, blood tests, radiological change, rate of amputation, rate of recurrence, and other endpoints. But until now, we had only result from the short period, 12 weeks.
If we can have a microphone in the second row. I know that William Jeffcoat has published a long-term study on osteomyelitis treated either conservatively or surgically, and can give an answer to the question.
Yes and no. We published a paper with 12-month outcomes. What we haven't published is the 8-year outcomes from the same population, where the original paper, which was published in Diabetologia with Fran Game as first author, reported that of the 117 people treated with antibiotics, the outcome seemed to be, well, the healing rate at 1 year was 82% in those who were selected for non-surgery. What we do know, but you don't know from the unpublished data, is that the 8-year outcomes are no different from those in that population. There is no evidence of long-term recurrence.
Okay, so you have to answer for the long term as well. More questions?
If I can add something in the meantime, there's one other study by Embel, a Canadian study that looked at long-term outcomes of conservative treatment.
Please raise your hands because we cannot address the hostess. No? No. Okay. It was a fake. So if no any more question, I will give the speech to Stefan for some brief summary and closure of this session.
Okay. I guess we heard 2 interesting talks about the theory behind infection and the open questions, especially in the prevention of infection and the non-existing evidence on that. We heard an interesting talk from Leslie Martinez about his trial with the caveats of different locations. That was one of my points, but you answered it already. And the second interesting part was seeing what came out of the Nordic and the Austrian Diabetic Foot Days, and I'm looking forward to hear next year what's coming out of this Diabetic Foot Day here in Madrid. So enjoy your lunch break and a good ongoing meeting to everyone.